started.
Good morning, New and Patrick. Nice to meet you both.
Good morning.
Could you both start off with who you are and what you do?
Sure. I guess I'll get started. So my name is, again, Mathur. I'm a physician assistant. I graduated in 2008 from Baylor's PA program in Texas. And now I'm a PA educator at the Mounds Physician Assistant Program. I have practiced as a physician assistant in various specialties over the years. Family medicine, internal medicine, urgent care, sleep medicine. So a little bit of everything over the years.
So I guess I'll follow up with my introduction. My name is Patrick Cafferty. I am a physician assistant. I graduated from the University of Kentucky in 1984, so been doing it a little while. Currently I'm an associate professor and chair of the Department of PA Studies at Mount St. Joseph University. I've practiced predominantly in neurosurgery through my career and pain management, and I continue to practice in pain management 1 day a week.
Okay, and when you were both practicing, could you talk about what a typical day what a typical day was like? I'm so sorry.
Sure. So it depended upon the practice. And so, as I said, I've worked in various specialties. I was mainly in an outpatient setting. And so when I worked in family medicine, for instance, clinic would start at 8 a.m. and usually the last patient was scheduled, 4:45, 5 p.m. But you rarely got done at that time. You usually stayed over. So most days it was kind of 8 to 5. You would see anywhere from 25 to 30 patients. Some days were busy. Flu season, it's always worse. And so you may see 35 patients a day. So that meant, going in and out of exam rooms, taking a history and a physical, seeing the patient, and then writing notes of the encounter in between patients as my MA or my nurse would be rooming the next one, triaging the next one, getting their vitals and things like that. I would try to review labs, any communication that might be from other physicians. And so it's a busy day, very fast paced. That's kind of how family medicine and internal medicine was. Sleep medicine, because it was a subspecialty, was a little bit different, fewer patients in a day. I was lucky to get like half an hour per patient, which is a luxury in an outpatient practice. So because it involved so much patient education, so I was lucky to do that. So in sleep medicine, I averaged maybe 14, 15 patients a day. Depending upon the specialty, I also had call, which meant that after hours, the patient could call the practice, and then the call would get forwarded to me. And so I would answer any questions. So sometimes it was weeknight calls, weekend, holidays, things like that. So that was kind of the nature of my outpatient practice.
So my practice in neurosurgery was perhaps a little bit different because it included both the outpatient office for some days of the week, and then oftentimes we would have 2 or 3 days a week in which we were scheduled for surgical procedures. So my typical day would start around 7 o'clock, 7:30 in the morning. I would round in the intensive care unit on patients that we had operated on for craniotomy, for removal of a brain tumor, or perhaps a traumatic injury, as well as, if time allowed, to go to the floor for patients that may have had spinal surgery. Then on the days that I would be in the operating room, we typically would have an 8 a.m. case, would go in and join in the surgery. We would, depending on the nature of the case, craniotomy, hours, some spine surgery, an hour or two. And we would have 3 or 4 cases on a day. Then there was call, similar to what Anu was talking about, where there were days of the week that you were required to be available, and that would entail, if there was a trauma or some sort, that I would have to go to the emergency room and assess a patient for a head injury or spinal injury, and then make decisions in collaboration with the neurosurgery staff, whether we were going to admit them or follow them up in an office. And then in the other days of the week that I was in the office would be very typical to what was described, where we would have anywhere from 20 to 30 patients, ranging from new patients with new problems to post-operative patients that may be coming in to simply have a wound check and to gauge how they're progressing with perhaps physical therapy and such.
So I know a lot of times students kind of debate whether between going into medicine and being an MD or going into medicine and being a PA. Could you talk about a little bit of the differences and why you chose PA specifically?
Certainly, it's one of my favorite topics, but I'll defer to Anu, who's the chair of our admissions committee.
And you pick this one first. Just kidding. Well, I think that's the nature of most of us who went into the PA profession. I think most of us growing up know when you think about medicine, think about nurse and doctor. I mean, those are the two aspects. That's what we're familiar with. I have two little girls, so 4 and 2, and they only know Doc McStuffins. And for them, they see doctor, and then they see, the Nurse Hallie, and those are the two epitome of what medicine is. And so I think that was no different for me. I started out in undergrad knowing that I was interested in science. I thought I would be a microbiologist, and that was my goal because I did science projects in high school that were based on microbiology, and I really enjoyed it. So I thought that's what I would do. And then I slowly, when I got to college and undergrad, this was at the University of Houston, I started exploring the various health science fields, and then realized, oh, there's more than two things, and then you start going down that path. But even then, I think I was convinced I wanted to be an MD because that was the most familiar thing to me in medicine. I remember very vividly, I was studying for the MCAT that summer, and I was volunteering at an emergency room fast track setting in the emergency room that was run solely by PAs. And that was the first time I'd heard of a PA, but I had never seen one in action. And when I saw that, I realized, why am I studying for the MCAT? I was like, this is exactly what I want to do. She was doing exactly what I hoped to do, was care for the patient, diagnose, treat. She was prescribing, she was splinting, she was suturing. She was doing everything that I ever thought would be interesting, or what I was gravitating towards when it came to medicine. And I could get done faster. And I would be able to practice quicker, and I would be able to change specialties, which was something that I really gravitated towards because I felt like there was constant growth and an opportunity for learning. And I remember that summer well. I came home, I told my parents I'm not studying for the MCAT, went and picked up a GRE book, and rest is history. I started shadowing more PAs to make sure that it wasn't just an isolated thing that I had seen. So I shadowed PAs in various specialties to ensure that this is truly what I wanted. And then realized that even though I'd heard all of those wonderful things about what a PA was, I think until I saw it and I could see them in action, it didn't make an impact for me. Because again, the traditional model of a doctor or nurse, everybody has seen at some point in their life, but recognizing what a PA, a PTOT, whatever, all these other subspecialties that, sub fields that exist, what do they actually do? So having that opportunity is what swayed me. And I think most of us who are PAs will say, very rarely do you say someone saying growing up, like I want to be a PA when I grow up, because they don't know what one is. It's something that they discover along the way. That was kind of my path.
Yeah.
Patrick, do you have anything?
Yeah, I agree wholeheartedly with that. And I think that it's the awareness part of the profession that's problematic, and particularly in this area, which has not had a PA program until we started the program at the Mount. So there's perhaps not as many. There are over 140,000 PAs practicing in this country that see over 9 million patients every week. It's not a new idea that's come out there. And I think one has to look at some changes that are coming about in healthcare. PAs by definition practice medicine in collaboration with a physician. So you're still getting to do all the things you want to do, And the historical romantic, if you will, view of being that physician working for yourself, having your clinic type of thing really doesn't exist. You typically work for a health system, you have bosses, and similar to PAs, they have bosses. So I think that it's the idea that you are getting to practice medicine in a team-based model with a shorter time span to complete your training, lower overall expenses relative to paying for your education, and the latitude to work in different disciplines over the course of your career.
Okay, thank you so much. Could you talk about why do you think it would be important to diversify the healthcare field, specifically PAs?
So I think diversity is so important in so many different ways. That could be the entirety of our conversation here. Students who train in diverse programs actually are far more comfortable engaging with people who don't look like them, who don't act like them. We improve on their cultural competence, their communication and interpersonal skills than somebody who trains in a homogenous, irrespective of where that is, but in a homogenous environment. So that's important. I think diversity from a training program is extremely important to try to work on the issues of access. We're not putting people where we need to. We have such a maldistribution of providers, and we know that with a diverse workforce, there are individuals who feel much more comfortable who, when they're meeting with somebody who looks like them, who comes from the same place they come from, who has the same life experiences. And we know from the studies that have been done that those patients are much more actively involved in their conversation with their provider. They spend more time, their overall satisfaction is greater, their compliance with healthcare directions are better. And I think it's an important step in just trying to improve health care in this country.
I agree. I think, those experiences are invaluable. Just talking about some of the paths that our students have taken to come into the program. And then when we talk about a case, or we talk about, a little obstacle that this patient may go through about how they're going to pick up their medications, and just those discussions, some of them who've experienced this, or if they've seen a family member go through it, and they talk about some of those challenges, opens the eyes to the rest of the group. And those are, we draw upon our own experiences, but they're limited. It's just one path. And so the fact that you can draw on everybody else's experiences to ensure, because you're seeing patients from all age groups, all ethnicities, all these, this wide variety. And so you can try to share, like, I remember that I may not have experienced this, but I've heard my classmate or my friend or my teacher or somebody else talk about these experiences. So it feels more real. And then you can think about ways and sometimes how to address it, and tips and tricks that you learn along the way to kind of help your patient. And so I think that diversity is really valuable to kind of hear those different perspectives of what they've experienced.
And I think it just falls in that category of, you know what you know, but you don't know what you don't know. And having that ability to share experiences within the educational environment, in what I like to think of as a safe environment for students to explore other areas, other upbringings and backgrounds, so that in the end, as we like to talk about in the program, our job is put the care back in healthcare. And how do you get there if you don't understand what somebody else's life experiences are?
And Anu, how is your experience? Like, could you talk a little bit about your experience being a underrepresented woman in the healthcare field? And if at the end, if Patrick, if you have anything you want to add from anything you've seen or experienced, feel free to add that.
So I think from my perspective, if you're checking off boxes, a woman, yes, woman of color, yes, but in reality, in medicine itself, South Asian women are not as underrepresented from that perspective. But I think that the experience of an immigrant, I think, is what I draw upon the most personally. I moved to this country at the age of 14, and I had I was thrown into freshman year of high school coming from India, and I had no idea how the education system worked. I made a lot of mistakes in trying to make decisions about, just simple things that people, because if you live here, you know the rules, you kind of know what is expected of you. And I didn't. And I made a lot of mistakes in high school. And based on that mistakes, when I started college, I made sure that I found a mentor and I spoke to my advisor as often as I could so that I didn't, not that I didn't make any mistakes, I did, but I made fewer of them because I recognized that I needed someone to guide me through this unfamiliar world because I was an immigrant in a society that, in this new country, and I didn't understand all the processes that are involved. I didn't understand the significance of having a really good freshman year, for the GPA to, pad your GPA for any upper level classes that may come later, or some small things like that. And I was grateful for the help that I had, and I found a mentor and I found an advisor. I think I bugged my advisor here every couple of months to make sure I was on track and I wasn't missing anything. I did the same when I discovered the PA profession. I think that is something that has helped me tremendously, finding, as Patrick said, someone like me. And I had a mentor like that. He was an immigrant from the Philippines who had become a PA. And I think when I first started shadowing, he was like, oh, look, another student who's interested in the profession. And then soon he realized I was completely lost trying to figure out how to do this. And he took me under his wing and helped me through it. And I'm ever so grateful because I wouldn't be where I am today if he hadn't helped me. I had applied to PA school. I got waitlisted at 2 programs that first year and I didn't get in and I was devastated. My undergraduate college loans were due and I had to start paying them. And I thought, okay, this is it. I got to find a job. I can't wait. This dream may not happen. I have to move on. And my mentor and my advisor at that time made sure that I didn't give up. And he said, this is okay. This is normal. It's competitive. You got to try again. And he pushed me through and he didn't want me to give up. And again, I'm so grateful because I wouldn't be here today if he hadn't done that, because my parents were immigrants. They didn't understand the system. They had never heard of a PA. They did not know what a PA did, and they couldn't guide me. They were supportive, but they couldn't guide me when these tough decisions had to be made. The following year, I got into 4 PA programs, and I got into Baylor, which is, I think, still a top 10 PA program in the country. So I think those are the experiences, the feeling lost, not knowing what other steps that I find, helpful. Now, specifically as a woman or woman of color, I have found that I've always been valued, from that perspective. My experiences as an immigrant or as a provider of color is something that my colleagues have always appreciated and leaned on. I speak, several languages. And so part of that, sometimes in a clinic situation, when I have to speak an Indian language, or I learned Spanish in high school, so then switch and speak Spanish with my patients, those things I think are something that make me unique and make me stand out and make me an invaluable member of the team. And that is, those are some of I think it's always been a positive experience for me. Luckily, I don't have any negative experiences, and patients appreciate that. When a patient walks in, and in Texas, I spoke Spanish with my patients a lot more. My first supervising physician was, a collaborating physician was Cuban. So 80% of his patients spoke Spanish. And so although I just taken a couple of years of Spanish in high school and then a medical Spanish course while in PA school, I got really proficient, quickly, even on that first job, because majority of my patients spoke Spanish. I moved to Ohio. The patient demographics is different. And then I remember in sleep medicine, there are a couple of these patients who were Spanish speaking, and we'd have to wait forever for the interpreter to come in. And if I walked in and I just introduced myself in Spanish and said to the get-go, I'm not fluent, but we can get the conversation going, their face lit up, they felt comfortable, and they were so thrilled that there was somebody there who could understand them. And I think those kind of experiences, when you make that connection with the patient, and it changes their world, it's the most rewarding.
Yeah, I agree as far as having some experiences, backgrounds, and such that are important. Mine is a little bit different. I was actually, my parents are Irish immigrants. My dad had a 5th grade education. My mother had finished primary school. I grew up in New York City, grew up in the projects in the Bronx. I did okay in school, but I didn't really have any direction, didn't have the financial wherewithal. I grew up in a real economically disadvantaged. My dad was a bus driver. I wound up joining the Army at 17 to try to find a direction, wound up learning a skill. Certainly was able to go to school for college, nights, weekends. I did similar to what Anu mentioned. Jeff Graber, a cardiothoracic surgeon, was a mentor for me, encouraging me as far as going on. It's where I first learned about PAs. I went into the military thinking I could get some money for college and maybe some pipe dream that I would actually go to medical school someday. Fortunately, I was able to get out. As a veteran, I had benefits that helped pay for my education. I subsequently went on to finish my degree in microbiology. I went to PA school. All of that was paid for. So when I look at my situation, and sometimes you almost feel like an imposter, that with my current role and where I came from, while I don't appear to be from a diverse background, I check boxes of economically disadvantaged, first gen college, veteran, non-traditional student, a lot of things that give me experiences, particularly when I'm working with students who are following a different pathway and trying to encourage people to follow that pathway.
It's great. Thank you so much. We have some questions if you guys want to unmute yourselves, or I could just go through and ask them. We can start in order. Sarah Ross, would you like to ask your question?
Yeah. What is some advice that you would give to underclassmen hoping to become a PA?
I think the biggest, most helpful thing is exploring the various professions. And if you've kind of decided that PA is something that you're interested in, try to shadow somebody, try to have a conversation. And next, like I said, mentors have played a very big role in my life to get me where I am today. So find a mentor, have someone guide you through that process, whether it is someone in the advisor's office or the pre-health profession society or something along those lines. And then a PA itself, find someone who can walk you through the nuances. And there's plenty of people out there who are willing to help. And I think it's just a matter of asking. I think it's the hardest part to ask for help. But if you ask for it, I think the bounty that you receive, is going to shape your entire life. And so just ask for the help and find a mentor would be my advice.
My name is Doe Gavin, and I'm one of the advisors in the Pre-Professional Advising Center at UC. One of those resources that Anu mentioned that some of you may or may not know about is the advising that you can get from the Pre-Professional Advising Center. We work with students up to and beyond the application cycle. So, and we really like to begin meeting with students as early as possible. So I really encourage you to check out our website, attend an intro workshop, and start meeting with us. And I will put a link to our website in the chat box. Thank you.
Can I add just a quick comment on that as well? I think absolutely shadowing is important and mentoring, but I would find some paid or volunteer position in healthcare and try to understand what healthcare is about, seeing it from an operational perspective and not just an observation from afar on a website or whatnot. Get in there, working in a nursing home, in a hospital, someplace where you actually get hands-on experience, not just to satisfy a requirement, but really to grasp what it is that healthcare entails.
I agree wholeheartedly. Thank you for bringing that up, Patrick. I think that you really do want to know, are you comfortable, with some of the quote unquote gross things about medicine? And then the other aspect of it is, just being more comfortable in this team setting, because no matter what your role is in medicine, we're a team. And trying to understand what all the different pieces are doing is so helpful. It is not a two-person system, where, like I said, it's a doctor and a nurse and everything functions. There's so many people that make this healthcare system strong to help care for our patients. And just having a little bit of insight of that is tremendous. So absolutely, I think giving those varied experiences, hands-on experiences, is what will also, in the end, help you during the interview process. Because most all PA programs do an interview before you get accepted within the program. And that's where those experiences will come in handy and you get to shine as an applicant. So absolutely, I think that's important.
And I saw in the chat there was a question about how advice for shadowing since we're in the pandemic. It's a lot harder now. Is there anything you would tell students?
It is definitely gotten a lot more challenging, but I think it was the hardest at the start of the pandemic. In the middle of the spring and summer semesters, summer, I think it was the hardest. But now most of the health systems are opening up, and there are more opportunities. It's a matter of networking. It's about attending those pre-PA society meetings and talking to friends and family to see who they have. And you start chipping away at it, because if you want to be a PA, then you start shadowing from the get-go. And it is not something that you want to wait till I'm going to apply in April, so I'm going to start shadowing in March. It's sometimes too late at that point. You should be starting, a year or two ahead. And most, for example, at the Mount, we require 40 hours of shadowing. And so it's feasible. If you break that up, you can shadow the same PA, or you can find other PAs to shadow. I think it's not impossible. It's just a matter of networking and putting yourself out there and talking to people. There are some virtual shadowing opportunities, some that you gain a lot and some not so much. So you kind of have to gauge that. But there are lots of opportunities out there. And you just have to network with others who are interested in the profession, like yourself, to help guide each other.
Are you all counting any of the virtual shadowing opportunities this application cycle or next application cycle for students who are applying to your program? Just curious.
Sure. So for this application cycle, we didn't. Most of our applicants, I can think of only one candidate who had some virtual shadowing. Everybody else had it in person. So it really wasn't a big deal for us this application cycle. It is something that we're evaluating for future cycles. I think now that the systems are opening up, we think that it is definitely an opportunity to learn, but we would rather have that hands-on experience where you get to have that experience. But it's not something that we've made a final decision for next year. We're looking into it.
Thanks. I think we have time for this last question that was in the chat. Michelle, are you still here? And would you like to ask your question? You can unmute your mic. Yeah, Michelle, you're still here.
Sure, absolutely. Thank you for sharing your insight. But I was just wondering, recently the American Medical Association posted the Stop the Scope Creep, which is like undermining like CRNAs, NPs, and PAs. So I just want to know about your guys' thoughts and how can we as pre-healthcare students advocate for optimal team practice?
Can I take that, Anu?
Yes, please. But the fact that you know optimal team, good for you, Michelle. I'm so impressed.
I was going to applaud that as well. I actually find that to be completely reprehensible. And if you look at either my Facebook or LinkedIn accounts, I've actually made comments to that and distributed a letter that came from Beth Smolko, who's the president of the American Academy of PAs. This is an entirely unbelievable response that the AMA has had for an organization that has completely failed its membership. It's looking at trying to feed the sharks within their organization and trying to offset their dwindling membership. There is no call for it. There are currently so many proposed shortages in physician community based on what the American Association of Medical Colleges is projecting for over 100,000 physician shortages, while at the same time, there's 10,000 people a day going on Medicare. The needs in this country are just unmet, and to think that you're not going to use PAs, NPs, and others, and that there is zero indications in the literature that there are any issues relative to scope. There are a number of articles in that letter, and please go to my LinkedIn page and you can find that letter, but it clearly shows the quality of care provided by both PAs and NPs relative to physicians. That I think is probably the first thing I would do in trying to look at that. Optimal team practice, as you point out, isn't a move towards independence, which is what they're actually making a point of. Stop the creep. Optimal team practice means that if Anu is working in her office, then they should decide how best to use Anu. If I'm working in Christ Hospital, my team at Christ Hospital should decide how best to use my service, not a board at the Ohio State Medical Board or any other medical board or the AMA.
Well said. And I'm putting a link here, if I can, let's see, from the AAPA response on there from Beth. So, but yes, I think there are some PAs who don't know optimal team practice. So Michelle, you've like really impressed me today. So I think that the fact that you are in tune about what's happening in the profession, and that's why I think it's so wonderful to hear that, but also why we at the Bounce program are ensuring that our students are advocates of our profession from the minute they join. The minute they start the program, they're members of the state and local state and national PA association, so that they can be advocates for the profession today and tomorrow. And so we kind of instill that from the beginning. So it's wonderful to hear that it's even, that you're interested in something like this even prior to starting your program. So wonderful.
In fact, we took all of our students on a bus trip up to the state capitol and actually had a breakfast meeting with a state legislature on these very topics. So our students get engaged in this early on, as Anu pointed out.
I think the last part that I'd like to share, because over the years, as being a PA that had students shadow me over the years, and now in admissions, I find that most candidates sometimes hear negative statements about their hopes and dreams of becoming a PA or joining the health profession because they don't have as good grades or something, or they got that C or something along those lines. And I just want to share that please don't let one person's negative thought throw you away from your dream. You have to find people who are going to be your advocate and push you through. Get more than one opinion. do not stray away just because one person said, I don't think you have the best GPA. You should probably not consider PA school or med school or whatever it is that you want to do. Find someone who's going to be on your side and help you through it and navigate that. And that's where I think having, as I said, a mentor, an advisor, or someone to kind of walk you through is really helpful. Engage as much as you can from the beginning. As Patrick stated, and from his experience, and the same thing for me. When I was growing up in India, my only expectation was I was terrible at school, terrible. My parents, my family, and everybody just assumed my biggest goal would be to finish high school, get married, and have kids. That was the expectation that I had. Nobody wanted me, nobody thought I was capable of anything more, right? You have to break free from that. And you have to find people who will let you get there. But you should have that drive within you, and don't let anybody, stray you from that. So I think that's the biggest thing that I hear often now that I'm admissions chair, is so many candidates from diverse backgrounds who say, well, I was told that my GPA was not that good, or my GRE wasn't that good, so there was no point in me trying. You always try. You definitely try. There are minimum GPAs, but that doesn't mean everybody, has to, the average GPA. So let me rephrase that. Sorry. Just because a program has an average GPA of the incoming class, it's an average. There are people who are lower and there's people who are higher, right? So just, you have to do your best to make yourself the best candidate and take your chance.
And I would never accept that you're not competent, capable, and qualified to get into any program. And don't allow the first pass at, as Anu pointed out, if you don't make it in the first time, that does not mean, find out why you didn't do that. What do you need to do to work hard on that? This sometimes takes effort. We have large numbers of applicants to the program. There are a lot of people who are interested in lots of programs. Continue your dream. Don't let anybody shut you down from what you want to do. Sometimes you just have to fall back, regroup, adjust your plan, and move forward.
I love that advice. I think it's a really great note to end on. Thank you so much for sharing your wisdom. This is really invaluable. I know Isabel had a question about the steps you took in your education to become a PA, so that may not be clear to everyone. So what I'd like to ask is that if you're comfortable, Patrick and Anu, would you mind just dropping your email address into the chat? And then that way Isabel could email her question to you directly, and you all could get connected in an exchange there. And then also, so that anybody else on the call that wants to get networked or connected to you all and the Mount St. Joe PA program, if the web page is there, or if you want to add your the LinkedIn profile that they can connect with you on LinkedIn. This is really about trying to stay connected and networked and, have this virtual mentoring platform that's ongoing, that doesn't just end here at the end of this call. So we have to close up for today, but we're going to keep the room open. So that information will be in the chat. And we'll be back here at noon with Jamie Gibson, who is a palliative care nurse, talking about her experience with diversity and the health professions. Thank you again so much. We appreciate your time.
Thank you.
Thank you.